You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thank you for joining us for American Medicine Today. I'm Kimberly Brumell, joined by Ethan Euchre.
Happy to be here.
And world-renowned orthopedic surgeon, Dr. Alfred Bonati of the esteemed Bonati Spine Institute.
I'm still here.
Yes, you are. Well, you know, we always talk about spine surgery. It's never something that you should just rush into. But once you've exhausted conservative type treatments and you realize you're not getting better, you don't have to deal with places telling you that there's nothing that can be done. You have to live a life in a wheelchair or on prescription medications. You just don't need to do it. You need to seek out a true resolve of your pain, and you can do so with the Bonati Spine Institute and their targeted precision procedures called the Bonati Spine procedures. They're exclusive and patented to our facility. And what's great is they have 98.75% patient-reported success. And we were happy looking back at a 7-year study. Well, guess what? We look back at all our records, and we're looking at 10 years of those types of results. So if you've been told nothing can be done, or you can just be slit down the front, slit down the back, and often confused, and we like to call it confused into hardware fusion surgeries, you don't need it. Bonati would be the alternative. Well, we have a great show lined up for you. We're going to speak with award-winning Cornell University professor Rodney Diedert, and he's going to talk about a new book, The Human Superorganism, and how the microbiome is revolutionizing the pursuit of a healthy life. Can I talk today?
Well, he's extending your life, so it won't be a happy life. That's kind of the purpose here. It's actually pretty cool.
It'll be a very complete, fulfilling life.
Well, and he was talking about, too, in the book that through the past century, just through our diet and things like that, we've pretty much destroyed that microbiome that keeps us healthy. And that's why we're seeing explosions of heart disease, obesity, and all of these different things.
What I wasn't aware of, they can even trace it back to the way you choose to birth your child.
Yeah.
I found that amazing.
Yeah, it's going to be cool.
And then we have another author, Lovey Reed, whose book, Forget Me Not, A Loving Mother of an Alzheimer, who had Alzheimer's. She's going to share this really touching personal story about that debilitating disease.
Yeah, her mother had Alzheimer's, and she
That's so awful to live through.
Didn't put her in a home, of course. Yeah. She decided to take care of her at home, and it's a pretty, like you said, pretty touching story, for sure.
And then, of course, we'll hear what's new in American medicine today. But up first,
in today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
It is my pleasure to introduce to the program once again. Is it Command Sergeant Major Gary Luttrell.
It's good to be back on the air.
Yes, thank you so much.
I just found out you have a bridge named after you.
Yes.
Is that what you and Doc were talking about? In honor of
I
you
do.
and your service.
Yes.
It's the Pinellas Bayway Bridge.
Oh, wow.
It's a long bridge. Takes you about half an hour to go through.
Yeah? Well, that's good.
He was a Medal of Honor recipient.
You'd rather have a long bridge than a short bridge, I would imagine. And you got the Medal of Honor.
Yes.
I received the Medal of Honor advising the Vietnamese Rangers in Vietnam in 1969.
Wow.
Yeah.
Excellent.
So you have been through the Bonati Spine procedures.
I have. Thank God. When I met Dr. Bonati, I walked with a limp for, probably 10 years. My quality of life was almost zero.
Yeah.
And where did the pain stem from? Was it an accident, just degenerative in nature, or?
I think, I injured my back numerous times while I was on active duty. Okay. And then I had failed back surgery with the Veterans Administration about 20 years ago. Yeah. And I was just classified as failed back surgery, take a pill and drive on.
Well, pain management, is it
exactly,
like call it?
Pain management. I was enrolled and still enrolled in the pain management program at the Tampa VA Hospital.
Sure.
But that's just a terrible form of managing your pain,
right?
You know, because a lot of depending on what they prescribe, you can become addicted. It's very habit forming, and like Kimberly said, it doesn't fix the problem; it masks the problem.
Right.
Well, I was a little concerned about opiates because when I was on active duty, when I first injured my back, I was in special operations, and our battalion surgeon would say, "Hey, a little codeine won't hurt you. Take a pill and drive on.
Right.
And that was the mentality back then. And unbeknownst, I was just doing further damage to my back.
Right. So what was that tipping? Well, let me ask you this. When you talked about pain, you mentioned that it was causing you to limp, but what were some of the other ways that it was affecting your life?
Well, it was embarrassing that I would have my wife do all the heavy lifting.
Right.
You know, it's just like, honey, can you pick this up for me? You know, I'm asking back then it was a 60-year-old lady. Now it's a 71-year-old lady.
Yeah.
Sweetheart, can you pick this up for me? I can't because I know I'm having excruciating back pain.
Right.
Playing with my grandkids.
But she told me that you still ask the same thing.
No.
Even now that you're better.
Well, it's because she spoiled me.
But that's a whole other story. But what was the tipping point for you that caused you to seek out further surgery?
I was I limped into a ball game.
Okay.
And I had a physician ask me, what is wrong with you? Every time I see you, you are limping bad and you have a frown on your face. And I explained the predicament I was in, failed back surgery. It's just something I might have to live with.
Sure.
And he was talking with a friend of mine, Dean Kachera, and Dean called me and he says, you know, you need to get an appointment and be evaluated by Dr. Bonati. You know, it won't hurt anything.
Sure.
You know,
Yep.
just go talk to him.
Right.
I did. We had an MRI, and Dr. Bonati looked at the MRI, pointed to it, and says, your pain is right here. Yes, it is. And here. And it radiates down here. I can fix that.
And that's another thing that people think, wow, you know, he doesn't ask you where the pain is. He tells you just by looking at your MRI. That's how well he knows.
Exactly. He didn't ask me where the pain was. He told me.
Right.
Your pain, according to your MRI, is right here, right here, and it radiates here.
And he was spot on.
And he was spot on.
Yeah.
So obviously that must have given you some confidence when you walk in and it seems that he's aware of where that root cause of the pain stemmed from.
Oh, exactly. I mean, there was no question in my mind. We're going to have surgery now.
Did you watch your surgery?
The first, I had two surgeries. The first one I didn't.
Okay.
The second one I did.
Yeah. And what did you think?
I didn't know what to expect. You know, I thought that him with all this metal in my back, I was going to feel pain.
Right.
And I'm laying face down watching the screen and watching him actually cut part of the bone from my hip and grind the calcium out.
Yeah.
And it's like, wow, I can't feel any of this. And then in recovery, with a propofol instead of a normal anesthesia, I was actually energized.
Yeah.
And
You wanted to get up and run a marathon.
oh, the second surgery was so great.
Yeah.
I did. I went back to the hotel. The instructions was try to walk at least 15 minutes twice.
Right.
My wife and I went out for a half-an-hour walk, took a break, went out for another half-an-hour walk.
Wow.
And it's like, and that's exactly it. It was like, wow.
Okay. Have to ask, how was that in comparison to that first surgery you had all those years ago?
Well, you know, 20 years ago, surgery was a lot different, but I had a major incision. They cut through the muscle.
Right.
I was in the hospital for 3 days. With weeks and weeks of rehab.
So comparatively, you were pretty much off and running from the time that you got out of these surgeries. Maybe not running, but at least you were up and walking.
I was elk hunting in the mountains in Colorado 1 week after the surgery.
Really?
Kidding.
Yes.
Did you get anything?
I did.
Nice.
I did.
Nice.
I filled my freezer up with elk meat.
Excellent.
See, that's great. Now, just explain for me, when you were on the table, did Dr. Bonati ask you to move around and try to recreate your pain?
No, he told me to shut up.
You were talking too much, Gary? Is that what was going on?
I'd propofol, just loosen my tongue up. And
You're like, man, this weather, this is
and,
great.
and I believe the way he said it was, will you shut up? You're distracting me. And we both laughed.
That's hysterical.
But he did ask, yes, do you feel anything in this location? Do you feel anything in that location?
Yeah.
So it was a good conversation after the, after the propofol high wore off to where I could talk without laughing.
So you were back to normal pretty much right away.
I was back to normal immediately.
Yeah.
I was pain-free immediately. The day after the surgery, I was at my son's football game, and like I said, a week later, I was hunting elk in the mountains of Colorado.
Did you ever think that was going to be possible?
Lord, no. I thought I was doomed with back pain for the rest of my life, and the only way it could be controlled was with opiates, and I'm scared to death of opiates.
Yeah.
Well, and I'm sure, and especially because you had that failed back surgery 20 years ago, so you had to live for 20 years, still in pain. Just you kind of wish that you had met Bonati
a long time
even
ago.
earlier, you know?
Oh, Lord. Yes.
Yeah.
Yes. I could have had a better quality of life for more years than I have. I'm 71 years old now. I've got a good quality of life.
That's perfect. All right.
And that is what Dr. Bonati lives for, to help each and every single one of his patients. And you become near and dear to us because you came in through our Wounded Warrior program.
Yes.
And we're so happy that we've helped you regain your strength and get back in motion. Thank you so much for sharing your story with us.
Thank you for having me here today.
And actually, you do, we're going to have a discussion about the VA and some other issues coming up later on in the show, so you're going to stick around.
Yes, please.
All right, perfect. If you or someone you know is suffering with neck, back, sciatic pain, migraines, RSD, you can reach out to Bonati at Bonati.com or call 855-267-0483. Coming up after the break, well, we're going to hear from Rodney Diedert about the human superorganism. Make sure you stay tuned. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years, and it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone, nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thanks for joining us on American Medicine Today. I'm Kimberly Brumell, joined by Ethan Euchre.
Happy to be here.
And world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute.
Hello.
Hi. Well, joining us right now is award-winning Cornell University professor Rodney D. Dirt to discuss his new book, The Human Superorganism, How the Microbiome is Revolutionizing the Pursuit of a Healthy Life. Thanks for being here, Rodney.
It's a pleasure to be on the show.
Mm-hmm.
Now, a lot of people have heard of the microbiome, usually in regards to like probiotic diets and fad diets and things like that. But I was reading in your book that the bacteria in our body, on our skin, in our GI tract, can make up as much as 90% of the cells of our body. That's amazing. Go ahead and explain that.
Well, the estimates range from a low of about 57% up to 90% of microbes, and that's not just bacteria, but other things called archaea and viruses and fungi and some parasites that live on the skin, in our gut, in our airways, our nose, our lungs, urogenital tract, and indeed, by cell number, they're either a slight or a larger majority. By gene number, they're even more massive in terms of their contribution, because it turns out our chromosomes in our cells only have about 22 to 25,000 genes, but across humans, the estimate for microbial genes is just under 10 million. So there are a lot of genes they contribute, and they're doing a lot in terms of our metabolism and affecting our physiological systems, like the immune system and the brain and the gut.
Right. You know what I found interesting from the write-up here is that you say the way children are born, that birth delivery mode, can affect everything. How does that come into play?
Right. Well, we've always known that we have ancestral genetics, but at least I was taught most of that came through the chromosomes that were inherited from mom and dad. And it turns out, again, with this massive microbial gene contribution, that a lot of that happens at birth or right around birth. So that during natural childbirth, the mom is actually seeding the baby with microbes that will form the gut microbiome, or that part of that. And then there's skin-skin contact that also helps to seed the skin portion of the baby's microbiome. And then later, breastfeeding will add additional microbes plus all those prebiotic components in breast milk that our mammalian cells can't even use. And it turns out they're really there to feed the microbes and to help them mature.
Okay, have to ask. There are so many antibacterial sanitizer and soaps out.
Even just antibiotics.
Is that affecting the microbiome as well, along with the antibiotics? Yes.
And the overprescription of those.
Yes. And a lot of this is unintended consequences. I mean, in a sense, we won the battle of the 20th century, or the first half of it, the fight against what were life-claiming infectious diseases in a major way, cholera, typhoid disease, and the like. But we overdid it. We didn't realize some of the consequences, that if some antibiotics in some settings were good, more would be better. And we kind of tried to purify ourselves as a species. But that's not how we're healthy. We're not a species. We're more like a walking coral reef or a mobile tropical rainforest. And in our healthiest state, we need all those species present, maturing together and cooperating together. And so that we're beginning to realize that. So that means that, yes, we over-sanitize in some circumstances. And quite frankly, antibiotics kill a part of our body that physicians are not intending to kill. So I think the message in the book, in part, is put back what you didn't intend to kill.
Got it.
Because we need it.
Is that a reason why sometimes when people are over-prescribed antibiotics that they can come away with C. diff?
Exactly. So it's not that antibiotics aren't needed. I mean, C. diff is a life-threatening, hospital-rich infection, I guess you'd say.
Correct.
And the problem is, if you do nothing else after antibiotic treatment, those patients, that group, are actually at an elevated risk for recurrent C. diff later, because you basically cleared the gut out of all the friendly bacteria, and C. diff has an even better chance to get started down the road in the future. And that's sort of the message of the book. I talk a lot not just about C. diff, but about what we call chronic diseases or non-communicable diseases. They're the majority killer, and even after the book went to press, the latest statistic now from the CDC is that it's killing 3/4 of global deaths are due to non-communicable diseases. So that's asthma, Alzheimer's, psoriasis, cancer, heart disease, diabetes, obesity, complications, and autoimmune conditions. And it turns out that's really the epidemic today.
Well, how are they?
We've replaced the infectious disease challenge of the 20th century with all these chronic diseases that we have to live with for decades and be medicated for decades.
Now, Professor, how are all of those non-communicable diseases like cancer and heart disease, how are those connected back to the microbiome?
Well, it turns out the microbiome, there are a couple different ways. The microbiome is actually sitting at our interface between our mammalian cells and the environment, the external world. So they are on the outside part of the gut. They're on our skin, at the barriers, the outside part of our airways. And they filter, or they're the gatekeeper for our food, our drugs, our environmental chemicals before the rest of our body sees it. So when they get out of balance, when things are wrong with the balance and the diversity and the seeding of the microbiome, then there are problems at those barriers. And it turns out your immune system, 60 to 70% of the immune system's in the gut, not in the lymphoid organs, but in the gut. So the communication across those barriers is critical. And when they're out of balance, you basically have inflammation that is inappropriate and gets started across those. You have barriers being compromised, and then you're just waiting, sitting for the immune system to malfunction. And it's a matter of what tissue it's going to happen or whether it's systemic, and then that's going to be supporting the non-communicable disease. So essentially, we know that children that miss seeding, babies that miss seeding, or that are formula fed, or that have antibiotics for ear infections, that they're at an elevated risk of these things showing up: asthma, obesity, type 1 diabetes, a little bit later in childhood. And those are just the entry-level diseases for more non-communicable diseases later in life that are connected to those as what we call comorbid conditions. So the microbiome is critical for our immune system, our gut, our brain, neurological systems, endocrine organs to really mature in a way that brings balance and homeostasis. We call it homeostasis. And in the absence of that, you're really set up for improper responses. You'll respond to peanut allergens. You'll respond to pollen. You might attack your own thyroid, and that's essentially what's waiting to happen with where the maturity of the immune system doesn't go according to plan with the microbes in place.
I did have a quick question, though. I know we're almost out of time, but you say here that changing your microbiome can change food cravings. So are you saying that it's not so much we need to be dieting, but we need to be changing the microbiome?
Well, I think both are really important. So it's very important to eat a healthy diet. But the problem is the microbes actually can signal our brain for the foods that they want to use as their energy source. So I grew up in San Antonio in the 1950s and probably ate a lot of fried chicken. Now I'm trying to eat kale, but I have microbes that were populated and grew and are huge numbers based on fried chicken. So they're not really wanting kale, and they know what to do about it. And as a result, it's really useful to get your gut microbes in line with the healthy diet you'd like to eat. Otherwise, it turns out your body's really working against you for that healthy diet. Because the microbes are making chemicals that signal something different. And I think that is why a number of people have trouble with diets is they know what they want to eat, they know what they should eat, but their body is calling for other things.
Got it. Simple. Well, that is a topic I could talk about for quite some time, but we're out of time, actually. So thank you very much for being on the program, award-winning Cornell University Professor Rodney D. Dirt, to discuss the book, The Human Superorganism, How the Microbiome is Revolutionizing the Pursuit of a Healthy Life.
Thanks, Professor.
Thank you.
Thank you.
Thank you.
Have a good one. All right.
I think I'm going to throw away all junk food so I can create a new microbiome. Anyway.
Start from scratch.
Exactly. We'll have author Lovey Reed up next to discuss the book Forget Me Not, A Loving Mother's Battle with Alzheimer's. Make sure you stay tuned. You're listening to American Medicine Today. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Bermel.
Thank you for joining us on American Medicine Today. I'm Kimberly Bermel, joined by Ethan Euchre.
Glad to be here.
And Jeff Wagstaff.
Thank you for having me, Kimberly.
Well, you know, we've had so many discussions about Alzheimer's disease. So this next guest, you know, she talks about how this disease is very devastating to families and how no one knows that better than our guest, Lovey Reed, whose book Forget Me Not, A Loving Mother Who Had Alzheimer's, shares her very touching personal story, and she's here to talk about it. So thank you for joining us, Lovey.
Thank you for having me.
Yeah.
Now, obviously, it's a terrible disease. I mean, it seems like every guest we have on, I have some personal touch with, but my great-grandmother had Alzheimer's, and it was really kind of before we even knew what Alzheimer's was. She just developed dementia, and, you know, at one point I remember I was like 13 years old, and she was talking to me like I was my grandfather, but a boy. You know, so she clearly wasn't there, and it's a terrible thing to watch happen to your loved ones. Tell us about your mother, Lovey, and how you started to first notice that she had dementia.
Well, I first noticed when my mother had dementia, but I didn't know what dementia was at the time. And I just put it on age-related. I noticed she would forget things. And, for instance, when we would go to the grocery store, she would forget some of the items that she had on her grocery list. And I still didn't put it with Alzheimer's or dementia. My thought was, Mother is getting older, it's age-related, and she just can't do the things that she used to do.
Right.
However, when I really thought about it, I wondered, do Mom have dementia? But I was like, oh, no, not my mother. And then she began to lose her keys, and she would go and backtrack, and she was able to find it at that time. But then it got to the point where she would misplace things, and she would not be able to find them even when she backtracked. But my education for Alzheimer's was so limited. I only knew that Alzheimer's was when someone forgets, and that was how limited what I knew about Alzheimer's.
Well, and then so how bad did it get, and how quickly did it develop, and how long before she actually received a diagnosis of Alzheimer's?
Well, after my mother had a car accident, we really thought something was really going on then. And the car was totaled, but she did not get hurt. So we begged her, Mom, please do not drive anymore. We'll take you where you need to go. So thank goodness she didn't. But when when she was diagnosed with Alzheimer's, she was 84 years old, and I was well in, in my 50s. And we started thinking back. Oh, so that was what was really going on with Mother at that time when we really couldn't see it. And, and we shared it with her because we didn't want to keep her in the dark, although she probably knew before we did. And I was in denial of it. And my siblings, they were as well. Mm-hmm. So we came to the reality that, this is something that's really happening to Mom and taking a toll on her life. And it took her away quickly. I mean, she just deteriorated in no time after she was diagnosed with Alzheimer's.
I mean, what do you mean by no time? Weeks, months?
I mean, when she was first diagnosed with it, she had things going on with her, and we didn't really know what was going on still, because we didn't know how to handle it. We didn't know. We never experienced that with anyone before that close to home.
Sure.
And I would say after about 3 years, she just really just went away. She stopped cooking. She stopped doing anything. She stopped talking. She didn't recognize me. She didn't know my name. Yeah. And I would say in about 3 years.
What was that like for you and your family at that point, to watch someone that you love not recognize you anymore, not be able to communicate? I mean,
it's terrible.
I'm watching my grandmother go through it, and she's 91. So I understand, but why don't you explain from your experience what you saw and how you and your family felt?
Well, first of all, we felt heartbroken to see that our mother was heartbroken, struggling with such a devastating disease that we were so unfamiliar with. And with Mother going through that, we decided to work together very closely as a team to make sure that, we do the things that she wanted us to do. And one of those things was not to go to a nursing home, so we kept her in a home because we knew that was her comfort zone.
Right.
And we made things really comfortable as possible, along with her familiar surroundings. We had a lift chair, a special bed, put it into her bedroom, a walker, and she hated that walker, although she needed assistance to get around, and that walker helped a lot. And she also had bathroom bars that she handles that she could hold on to. And we wanted to make her comfortable and provide the best service and care as possible to accommodate her needs.
Lovey, my heart certainly goes out to you and your family to go through this. I imagine one of the biggest challenges as the disease progresses, and I don't know that people realize this, is that our loved ones need constant care and constant supervision, because they may wonder, they may hurt themselves, they're no longer aware of their faculties, and that puts a tremendous burden on the family.
Yes, it does.
Were there enough family members who were able to kind of tag team by spending time with her? Did you have to bring in, medical help or nurses' aides, that kind of thing, just so that there was always someone with her? How did you handle that aspect of the disease?
Well, first of all, my mother gave birth to 14 children. Okay. And there were 13, that survived. And 7 of us lived in her area. And we said, okay, 7 days in a week, we can get a couple of nurses to come in, and we can do this. So we got the advice of the doctor, and we found a couple of nurses. We also went out and sought we already had a primary care doctor, and we found a geriatric doctor to come in and really, work with her. And we had a physical therapy. We had 2 nurses, and each one of us, we shared our time 7 days a week, and we had a family meeting to find out who can do what, how many hours, how many days, and each one of us shared our time and worked as a team, and everybody was responsible for what they had agreed to do, and it really helped a lot, and Mother was never alone. We made sure that someone was there 24/7, and when one of us got a little overstressed, we made sure that one of us that was not as stressed, we took that person's place and shared our time so that person could, get a little, relief from stress. So we really worked it. It was a struggle. It was not easy. We had to make some sacrifices, but she made sacrifices for us and showed unconditional love. So we was not going to abandon her. It was our time to show unconditional love and make some sacrifices for our loving mother.
Very well said, Lovey. Very well said. Thank you for sharing that.
Just about out of time, Lovey, but in closing, what is the biggest piece of advice you can give to families who are facing a situation like that where they have to take care of a loved one who develops dementia? What's the best piece of advice from the book?
Well, one advice I would give, if possible, try to keep them in their comfort zone, which is their home. Work together as a team. In the home, try not to make the surroundings unfamiliar, just as I did. I moved pictures and all that, and I found out I really was causing more confusion for my mother, but that was after the fact. And to show that person lots of love and patience and just be there for them at all times. Give them a little kiss and a hug and let them know that I love you, because that worked for my mother. I mean, I could just see the sparkle in her eyes. And as a team, we're not going to agree on things all the time, just as my siblings I didn't, but we have to realize that this is not about us. This is about Mother, so we need to focus on her, not about us and what we think and what we feel. Let's give her the best care possible.
Thank you so much. Lovey Reed, great book, Forget Me Not, A Loving Mother Who Had Alzheimer's. Where can people get your book?
They can get it from www.duran'sbookstore.com.
Okay.
Barnes & Nobles, Books A Million. They also can get it from Amazon.
So pretty much anywhere books are sold, they can pick up your book. We appreciate it. Thanks for sharing your story, Lovey. Lovey Reed.
Okay, thank you for having me.
Have a good one. Bye-bye. It's
what a great
tough
story.
To watch.
It's
super tough to watch, trust me.
Well, that about wraps up this segment. Make sure you stay tuned, because on the flip side of the break, you're going to hear more. You're listening to American Medicine Today.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brummel.
Thanks for listening to American Medicine Today. I am Kimberly Brummel, joined by Ethan Euchre.
Glad to be here.
And world-renowned orthopedic surgeon, Dr. Alfred Bonati.
Hello. What's going on, Doc?
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
All right, so you want to talk about health insurance, correct?
Yeah. Well,
right.
The insurance companies are going against the current. Mm-hmm. But there are certain insurance companies that they are wising up, and the insurance that they are working well, they understand the possibilities to destroy their own industry, are coming out immediately, very fast, out of this Obamacare and all these restrictions for the doctors and control of medicine and all this.
Sure.
I want that you understand I have nothing to do with insurance, but I am in the field of treat patients. Mm-hmm. And they are patients that I can treat, and they are patients that, despite that I want to treat, the business part of medicine will not work. Medicine has two components, a responsible medical way and also a business.
Right.
And both they need to work so the system remains working. Mm-hmm. Well, when the insurance companies start to squeeze the physician to a level that the reimbursement is very poor, the physicians stop taking that insurance. Mm-hmm. Example of that is the situation that happens with Medicaid, with Medicare is having a lot of problems now. Certain HMOs like Humana, and actually now one of the biggest insurance like Blue Cross and Blue Shield is a really crappy insurance. Mm-hmm. So what happened with that type of solutions, the patients are now scrambling for treatments, and they found that they are not being welcome in the medical offices.
Right.
So, but you have two insurers that they are fantastic. Those insurers are guided by intelligent individuals that they are at the command of this business. Mm-hmm. And that is United Healthcare and Cigna.
Okay.
If you, by any circumstance, have any one of the other insurance, you should consider the possibility to change this type of insurance, because if you ever get sick, you cannot believe the nightmare that you are going to face.
Right.
Now, and the insurance companies, if they really look at the management of the medical management when you use a hospital or an ambulatory center, the insurers start to realize that they are going to save around $38 billion if they only use ambulatory centers as a provider for the health care of those patients. Mm-hmm. And the patients are going to save $41 billion a year. We're talking about a year. Mm-hmm. If they use these units. There are 5 reasons why those units are more in favor of the patients today. Because every time more and more patients are going to ambulatory centers, and they are start to be far from the hospitals. And one of the things is the expenses are less. The second is the quality of the service is far better. Then also the facilities look cleaner, organized, and prettier. And the results of these units are better because they are managed by physicians. So the heart of medicine is on the system. And the most important thing is the evaluation of these patients by patient satisfaction. What is very amazing to see that when you talk about evaluation of patient care, the insurance companies, they didn't realize yet that they need to look for patient satisfaction. They don't need to look for the results of how good is the surgery, how long is the surgery, how many females or how many males are being operated, how long is the time of the surgery, what type of instrumentation was used. That is totally useless. What you need to know is the patient happy? Is this patient better? And nobody evaluated that one. And that idea came from us for around 3 years, more than that, around 5 years ago, we started to talk about we need to know if the patients not only are better, but if also are satisfied. Now, if you look, the amount of expenses, the government create this patient satisfaction doesn't exist. So they evaluate the product, but they don't evaluate the result. And then when they do that, they spend $15.4 billion documented the procedure. But they don't document if this patient has good results or not. So it's amazing to see how those expenses are being how that money is being spent in a wrong evaluation. And at the same time, each physician pays around $40,000 per year just to supply to the government and to the insurance company the information of the procedure results, but they don't evaluate if the patient is happy or not.
I see that they're also using discriminatory deductibles against ambulatory surgical centers.
Yeah, that the bad insurers are doing that. The bad insurers are increasing the amount of deductibles to the patients, and they are punishing the ambulatory centers, and they are trying to push the patients to the hospitals, and all these dirty tricks, but it's not working because the patient is going and saying, I'm not going to go to the hospital, I'm going to go to an ambulatory center. And it's a big fight with that. But if you look today, the care of the ambulatory center for health care is 40% already on ambulatory centers in comparison to the hospital.
And that's a look at what's new in medicine today with Alfred Bonati, MD.
That about wraps up our program. Make sure you check us out on your local listings for Bloomberg, WFTS here in Tampa, KTNV, and we're on a Fox affiliate now in the Fort Myers area. So make sure you check your local listings.
Fox 4 in
Fox
Fort
4,
Myers.
yes. American Medicine Today. We'll catch you next time. Bye-bye.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.